For more on the situation in Gauteng, let's cross to Dr. Mark Human, who is one of the South African Medical Association's board of directors, and he's also at the coalface of the pandemic in Johannesburg. Doctor, thank you so much for joining us. I mean, as a doctor, we really need to know from you, please, what it's like working on the floor in those hospitals. What's going on right now?
Good morning, Annika, and good morning to your viewers. And to be brutally honest, I can only give you second-hand reports of that. I am the chair of the Gauteng branch of SAMA, but ironically, I'm not at the coalface at all because I'm an orthopedic surgeon, which means that my skills are of not tremendous use at present. That's a very long and difficult story to explain. The situation, however, and I have this from my many SAMA members, is severely dire. Our provincial hospitals are running at overcapacity. Our private hospitals, and I'm in the private sector, is running at overcapacity. My specific hospital, as an example, currently has just under 50% of its occupancy as COVID-positive patients. To put that in perspective, at the height of our last peak, about 15% of South African beds were being used for COVID. But obviously, Gauteng has been hit particularly hard this time round. Looking at our national numbers paints a story that's not really that bad, with a rolling case average of about 20 per 100,000. But Gauteng's is well over 100 rolling case average, and sometimes approaching 300 per 100,000, which is unbelievable numbers. People are being turned away from public and private hospitals. People are being made to sit in their cars waiting for oxygen supply. People who desperately need it on any criteria that you want to consider to be admitted are being sent home with home oxygen where that oxygen can be sourced, because there is a massive oxygen shortage as well. So it's dire at the moment. And there are some real ironies about this entire pandemic, and that is that there are unemployed doctors. There are plenty of doctors in both sectors who are not being utilized, and this just speaks to organizational ability. Of course, add to the perfect storm the fact that Charlotte Maxeke has been closed for 2 months following a fire, and what really results from a bureaucratic failure at the utmost level, because there are ways to reopen things or to make things accelerate. The Chinese built a hospital in 10 days, yet we can't make our hospital available for occupancy in 2 months following a fire. It's quite inexcusable.
Doctor, sorry I misrepresented you as being there, doing intubations, etc. But, are you going to get to a stage at private hospitals where people like yourselves get diverted and they get moved into the COVID wards? Has that happened yet?
Well, there's been quite a lot of talk about it. It was initially hatched as an idea in the first wave, and then it went very quiet in the second wave. But of course, doctors at the end of the day are still doctors and can be utilized across the board, even if our skills have been super specialized over time, especially if working in a team and especially if working under the guidance of people who are real specialists in that department. So this has been mooted again, and hopefully it will come to fruition if our numbers justify it, which I think they do.
Doctor, last question. The morale of some of your members, it seems to me from speaking to doctors that I know, their resilience is really down. This is the third wave and they are tired already.
There's no doubt about that. Even after the second wave, many of our colleagues, our internal medicine physician, IC colleagues, looked shattered. And how they push through and just keep dealing with wave after wave, it's hard to understand. The lack of capacity that we have at so many different levels is quite disturbing. And obviously this is a systemic thing that's happened over many, many years, but it really desperately needs to be addressed.